Now I am going to inspect his neck and spine. I'm looking at his skin and the rise of his chest from behind. It is symmetrical, no accessory muscle used from this vision point. I am going to palpate his spine for any masses or pain, starting at his neck and working my way down, noting any pain or visual abnormalities. Any pain anywhere?
No.
No. I am next going to I'm going to palpate his. I'm going to percuss his lung fields. And I'm noting any areas of density or unevenness, and the percussion does not show that. Now I'm going to listen to his lung fields. Take some deep breaths. Breath sounds are clear, no wheezing, no bronchi or crackles noted. Now I'm going to have my patient lay down on the exam table. I'm going to stand kind of behind him while he's in the supine position. I'm looking for any jugular vein distension bilaterally, and I don't see any jugular vein distension. Now I am going to look at the chest rise. It appears symmetrical with breathing, no asymmetry, skin looks good color, it's intact, there's no bruising or rashes or scaling noted. Next I am going to osculate his heart sounds. I am going to start at the second intercostal space closest to his sternum, and I am going to be listening for the aortic valve. I'm going to move to the second intercostal space away from his sternum, and I'm going to be listening for the pulmonic valve. I'm going to move down to the third intercostal space, listening at Erb's point, and down to the fourth intercostal space, listening at his tricuspid valve. Finally, I am going to move to the fifth intercostal space using the bell of my stethoscope. I'm listening to the apex of his heart and to his mitral valve. I'm listening to his rhythm. It is loud and regular, no murmurs heard, no skipping beats heard. Next, I am going to visualize his abdomen. I don't see any asymmetry, no protrusion or masses, no hernias noted. I am going to listen to his bowel sounds first in all four quadrants. And I would do this for a full minute normally, but he does have bowel sounds present. I'm now going to use the bell of my stethoscope, and I'm going to listen to his aortic artery. I'm listening for any bruits, any pulsation. No bruits heard, no pulsation noted. I'm going to now move on to his femoral arteries, just because he's in this position, and I'm going to listen to any bruits in his femoral arteries using the bell of my stethoscope. Femoral arteries and his abdominal aortic artery are symmetrical and even when listening, and I'm going to palpate his femoral arteries now. And and both are symmetrical and even. Next, I am going to palpate his abdomen in all 4 quadrants, noting any pain or tenderness. Both deep and soft palpation done. Any pain anywhere?
No.
I'm going to percuss over his 4 quadrants. I'm going to percuss over the liver, noting the density and the change in sound at the bottom of the rib. The liver does not extend past the rib. I'm going to do a deep palpation. Any pain?
No.
No. Next, I am going to, let's see, next I am going to have him sit up. I'm going to inspect his legs. I'm going to be looking at his skin integrity, the color, noting any swelling or abnormal color or discrepancies in color. I am going to now palpate his skin and his legs on either side, noting any edema. I am checking his pedal pulses, and I am noting the pedal pulses on either side. Both are symmetrical and strong. I'm going to check his tibial pulses on either side, noting the symmetry and strength and regularity. Now I'm going to check his popliteal pulses behind his knees. Stretch it like that a little bit. Noting the pulses there are both strong, regular, and symmetrical. I am now going to note that the temperature is normal. He has no edema. I'm going to check his patellar reflexes. My stethoscope. Sit back, please. Patellar reflexes bilaterally present. I am going to check for dull and sharp sensation. Please close your eyes. Tell me what the sensation is, dull or sharp?
Sharp. Dull.
Okay, sensation's appropriate. Next, I am going to have him stand up, and we're going to check his balance, and we're going to do a couple of tests. I'm going to have him start over here, turn this way, and I'm going to have him close your eyes with your arms out, take 4 steps forward, and turn around, walk back. I'm looking for any swaying or loss of balance here. Turn around. I'm going to have him walk heel to toe now, 4 steps, and turn around, walk back. Gait is even, he's got good balance, he's not swaying or losing his balance, and that will end our assessment.